Hey, welcome to the
Doceree Dialogue,
a platform that unites industry leaders come together and exchange ideas, innovation, and insights.
shaping the future of healthcare marketing. Hello, Courtney. How are you?
Good. How are you?
Great, very well. Thank you for joining us this afternoon here at Fierce Pharma. Maybe for the listeners, if you could just tell us who you are, where you work, that would be great.
Yeah, sure. My name's Courtney Mullen. I oversee our paid search and YouTube activation at CMI Media Group.
And how long have you been there?
This is my 11th year out of
Wow.
So
Amazing.
I've been in this leadership role for about 5, 6 of those years. And then before that, just managing clients directly, client relationship, search strategy.
And where were you before?
I was at some smaller agencies and other health agencies before that. I think we've been doing audience targeting long before everybody else started.
I remember my doctor many years ago.
Yes. So, I mean, we've been at the forefront, and I think that's continued to help us be explosive to see that growth, to gain client trust, to get more clients, to get bigger clients, to really see that.
I see a little bit of international expansion as well, right?
Yes.
Which is really good.
We continue to expand internationally. We continue to get more and more clients internationally.
So search is really, really starting to change from what it used to be. You know, Google's thing was always to get you the thing that you're looking for as fast as they can, right? What are some of the major changes our clients combined should be aware of as we look at search over the next 6 months, 10 months, 12 months?
Yeah, I don't actually think Google or any of the search engines' goal has changed. I still think they're trying to get the most relevant information as best they can. I guess what that means for advertisers is being adaptable to how they're showcasing that. So with the introduction of AI overviews and with AI mode as well, we're looking for what those solutions are going to be. They don't have them in place for Pharma yet. They're starting to roll them out for other platforms as well. But what we've been advising clients on is really start with organic. Make sure you are optimizing your content to be found in those places. And then from a paid standpoint, it's getting prepared to have ads be released in those places by testing things like broad match. That's a match type in the space that allows you to be surfaced when people are asking those questions. The queries are getting longer. They're getting more extensive as people are getting more creative with how they're asking for things. So we no longer have to create this finite list of keywords. We have this tool and the engines that we work with that we can be there. We can capture that. So I think it's really been getting the pharma clients comfortable with opening up some of the boundaries that previously were in place that weren't as informed by data, that they weren't as informed by these intent signals. And it's really trying to break some of those old habits that these are really smart technologies. They're really smart ad products that can really help set you up for success when those ads do get released within those platforms.
Well, you've got the two, right? You've got the organic search where a lot of pharma companies were still not tagging content well enough, not doing anything related to just organic. And now you got paid, and now we've got Chat GPT coming through. So now you have to be discoverable on AI as well, right? So it's a different mode. Are you guys starting to do that as well? Are you seeing pharma trying to do that at all?
We definitely have a lot of interest in that. I think the what we're telling our clients and where they need to be isn't too dissimilar to what it was before. You need to have helpful content. You need to have that authoritative content to be found in these places. And I think getting comfortable with this information being displayed directly in order to get people there.
Yeah.
It is a bit of a different user experience than before, but I think the mantra of just having that helpful content and building helpful content and building content.
Yeah.
I feel like that's usually a problem in pharma is there's not enough content.
Or they say we've got brand.com, right?
Yeah, but I mean, the content needs to be beyond just the website.
Exactly.
You need to have the video content, the audio content, all of it's being surfaced in these places now, and it all is things that are discoverable by these chatbots to be able to surface. So differentiating the type of content and not just one type of content is also a really key piece that we're applying.
Do they, all of it has a cost, right? So do you get sort of the questions of, this is all great. And yes, we want to be top, but we only have $2.30. You know?
All this blue eyes. Yes. Yes, I mean, and that's also where AI is coming in.
Yeah,
Like I
exactly.
said, we have a lot of great tools that we've been able to build internally, build at CMI directly, but also tap into our parent company, WPP, who has an immense
WPP Open is
cool.
very slick.
WPP Open is informed by a lot of data
Very strong.
and helping do anything end to end, creation of content, creation of decks. So it's really been able to create some of that content at a much more affordable price. And it's something that we've been doing for a while. I mean, we've had other partners, but I think now it's even more informed by data signals that previously it was able to generate content, but it was a lot more of a manual informed versus some of these data informed processes that can be happening a lot quicker.
We've interviewed a couple of people from the pharma side here over the last 2 days, and their role, their sole job, is now looking at how can they do modular content at scale and make it relevant based on data that they're getting. So it seems like the clients are starting to think about it as well, right?
Great.
Which is
Great.
great news,
Yeah,
right?
that's great
Which is
news.
It's only 2 companies. Let's not get too excited,
Start.
but it's a start.
Yes, you didn't talk to all the companies. Hopefully that was just a small sample set
Yeah,
of the larger sample.
exactly.
Yeah.
Exactly. So let's turn to agility. How was it?
Agility was amazing.
Yeah.
Like, it was very energizing. There were some great speakers there. Damon John was there. Like I said, I got to talk to Dr. Mike about building authentic communities and content that really resonates with the community, the patient community. More important than ever.
Yep.
A lot going on in the United States with different health policies that I think he's really built that trust with his partner. So there was a lot of really great content covered from caregivers, elevating the patient experience, and some good entertainment too.
Really?
Yeah, there was a great violinist there.
Oh, yes. Beyonce's violinist. Yes, yes.
The violinist was there.
She's following you everywhere, the CMI people. I met her last week in San Francisco.
Oh,
Or 3 weeks ago, sorry, at the event in San Francisco that you guys put on. So that was really cool.
yes.
She's amazing.
She was very good, and she was playing all genres of music. It wasn't just classical, and I think that's what she's known for, is really kind of like bending the boundaries of what's possible in string music. So it was great. It was really energizing, the event overall, and I think it really took on what we wanted to, is just being the unconference, just from the setup of the event to speakers at the event to just the feel of the event, and we achieved that. I think it was very successful.
Any one key takeaway for you from your day-to-day job from agility?
I think for me, it really was about trying to figure out ways to work across the team that is additive, not duplicative. I think that's something that we're trying to do every day, but I think really trying to make sure that we're delivering what's best for the patient. And I think there's a really strong message about the caregiver too. I think oftentimes they get left out of media plans, out of conversations, and sometimes with the treatments that we support, they're a really big part of who we need.
They actually make the decisions.
They're the decision makers in a lot of places.
Yeah.
So I think that was really key. And then our keynote speaker of the day was, forgetting his name, but he was from a company called Not Impossible Labs, and really just showcasing that nothing is impossible. And having that mindset of nothing is impossible, I think really taking that away, that was a really big takeaway for me, is
Amazing.
nothing's impossible. We can do things. It will take time, or it might take certain money, but he really showcased how it doesn't need to take a lot of money to do some of these things. That was really, really inspiring, the things that team is doing.
I'm really impressed. I used to work at Ogilvy, and there was a creative director we used to have there. Really, really inspirational. And he used to always say, same thing. Nothing is impossible. It's time and money. So if you want us to paint the moon blue, we'll figure it out. But it may cost $1 billion to send that shuttle up there to do it, right?
Yeah.
So you're right. If we can put our mind to it, I think we could do something amazing, right? So amazing. Let's turn to Fierce Pharma. You've been here a couple of days. Did you come? Or today's your first day? Oh,
Yes, it's my birthday here. Yeah.
Have you seen anything here that you've gone, whoa, that's interesting?
I did attend the panel earlier on TV is Canceled. I think that was very timely. It was Exact Health.
Yeah.
There's a lot of people there, obviously interested in
Especially from the announcement
it
yesterday.
happened yesterday,
Yeah.
and really just trying to talk through some options there,
Yeah.
what's possible. And I actually took away that nothing's impossible.
Yeah.
I think that was some of the things that they were mentioning is, hey, this isn't going to be impossible. Like there's going to be ways around it. We always find ways around it. But it was definitely an engaging audience as well as panel.
Yeah. It's fascinating because I started in healthcare when social media was just coming out. And it was the same thing. You'd go to a brand marketer and say, I want to do something on this Facebook thing. You know, you know,
That's now table stakes
there you go, right?
to be on this.
You got to figure it out.
Right.
Right. So
That's where your audience is.
exactly. Exactly. Where do you think, as you sort of look over the next 6 months or so, we're going into brand planning now, right?
Yep.
What are you counseling your clients about to think about for their budgets for 26? What are some of the options that you're providing?
Yeah, and I think there's this thought in search specifically is, well, maybe I don't need as much money in search
That
because of
seems to be.
entrance. But people are searching more now than ever. They are searching. They're using these other platforms, but they are still searching. The data shows it. They're still searching.
Yeah.
Some of the clicks might be going down. Some of the click-through rates are going down. Overall, we are seeing that we're still able to achieve the goals that we need, even when we do see some of that limited click-through rate go down. And part of it is we want to get a more engaged audience. So we're making sure that we pre-qualify them. So we are okay if our click-through rate goes down as long as the quality stays there, as long as we're still reaching those goals of those quality audience that we're wanting to get. And we have those really tight measurement goals. I think that's been really key in the success that we've seen over the past year, 2 years, building up with clients is really diving into what metrics are moving their business. We don't want just the surface metrics. We don't just want you visited the prescription page. We want to know what action will drive your business, what are going to drive prescriptions, what are going to drive patients to ask. So we've had very deep discovery sessions with clients, with partners to kind of figure out that measurement plan, to build really smart measurement plans. So we're not seeing as much of that in depth. And we don't recommend to pull back on search. We recommend to keep leaning into search, to be more open to the technologies, to not be as controlling of, I don't want to say this. I want to limit where my ad goes and things like that.
Only want to use 2 keywords, that
Yeah,
sort of stuff.
trying to get clients and their teams comfortable with where their ads can be, how they will show up, so we can take advantage of all of the AI signals and all of the bells and whistles that are out there in the search space, so they can be in those spaces when ads become available.
I've been trying to get rid of the click-through rate for 10 years now as a measure, the only measure sometimes, right? When you look at what you've just described, it's all around, can we engage somebody? Can we make them aware? Can we get them to a place where they can do something? And then maybe there's a click-through to something to buy, right? But there's that whole upstream, and you're still measured on click-through in all of those things. And maybe there's a model that says it's a combination of impressions, clicks, engagement, and click-through. Is there anybody thinking about things like that? Can we ever get rid of the click-through rate
Yeah, I mean, I think
as a measure?
what we've tried to advance is more value-based bidding.
Okay.
So really adopting a methodology for figuring out what's the most valuable action once they do click.
Yeah.
So it's not just that they clicked. That's important, but what things did they do? It's not just one thing. Hey, this thing is really going to drive my business. It's really going to drive revenue. So let's place more emphasis on it. All of the search engines have a lot of smart technologies that can help us find that. I think we've seen a lot of progress with making sure all the data sources are connected to feed that model to be able to drive those most valuable actions for the client. So click-through rate, I agree. I would rather it not be the first metric that's looked at, but we certainly want to get people to the site that are taking those actions that are driving revenue for our clients, or that are driving action to get patients the help they need.
We focus on healthcare professionals, as you know.
Okay.
So all of our work is around how do we get the healthcare professional to do the same thing, right?
Mhm.
How do they behave? Can we get them from here to there? The whole nudge solution is so similar to this next best action that Pharma has been enamored by for so many years. And we're also still seeing that sometimes the click-through rate is the only thing the customer focuses on. And we're saying, wait a minute, we just engaged 1,000 doctors who now know about your product.
Yeah.
And maybe 2 months from now, they'll come back, which leads me to the attribution question. Are you getting a lot of attribution questions still? Or are you able to, with new technology, do it better?
I don't think we're getting it as much. I think share voice is definitely one we still hear a lot of,
Yeah.
which we also try to shy away from because really there's not a lot of ways to impact that, but add to your budget. So that's not typically something that clients want to hear. And I think that's really why we've been pushing the value-based bidding.
Gotcha.
And I think it's been a learning experience for clients to really make some of these tough decisions. Is not everything can be important on your website. Not everything is actually driving
Yep.
your business and driving revenue.
Yeah.
And we really need to have those discussions. Sometimes we have the measurement to back it up, like a cross-six that actually showcases that. Yeah. And sometimes we have to do a little bit of our own napkin math and also adjusting. If we don't see that it's making that needle move, then we can go back and adjust that attribution model or that value-based bidding model that we have in place.
Interesting. So we've got a couple of minutes left, maybe a minute. Anything you'd love to see in the next 6 months or a year that you would go, whoa, that's cool. I'd love to do that.
From a search standpoint,
Yeah.
I think
Or in general.
really,
Yeah.
well, from a search standpoint, I would say what I would love to see is more advancements with how we can reach patients most effectively.
Gotcha.
There's a lot of restrictions, obviously, for privacy concerns on the patient side, but I do think there's value in being able to reach the patient at a time that they need it the most. So being able to do that most effectively. And there's been advancements on the HCP side. We now have the ability in both of our major platforms to be able to target HCPs directly with the target list that we have. And maybe not to the same degree, definitely want to keep privacy in mind, but being able to kind of find some of these similar audiences from a patient perspective and be able to use them and figure out a way to do that in a privacy-safe way, but a more targeted way to be able to help more of these people.
Amazing. Courtney, thank you so much for
Thank
taking the
you.
time.
Thank you so much
I
for
really appreciate it.
Thanks.
Have a great day.
Thanks. You too.
Thank you.